Hello, I'm Dr. Russell Libby, and this is To Your Health. This is a show presented to you by the Medical Society of Northern Virginia, a great organization looking out for your health and making sure you have access to quality care here in Northern Virginia. You know, we all hear about new genres of treatment to try to keep ourselves healthy and young. In fact, sometimes we read advertisements on treatments that might actually give you back the youth that you've lost. Well, there is some tincture of truth to that, but for the most part, there isn't. Essentially, stress, improper living, and all those kinds of things that relate to not being really very healthy. And most of us know when we don't live a healthy kind of life, we have bad diets, we don't exercise right. But essentially, we can do things to our bodies that cause premature changes that really are things that seem like they make us age. There's a special area of medicine that's evolving called anti-aging medicine that is trying to deal with understanding how and why this happens and what we can do to help prevent or change some of those processes. We have with us two doctors who are practicing this, and it's a new subspecialty. Dr. Lenise Lawson, thank you for joining us, and Dr. Patricia Pettit.
Thank you.
Appreciate you coming on the show. Now, I've given a little bit of an introduction as to what anti-aging is, and I tried not to give too much of one because I really want you who practice anti-aging type medicine to give us more of an understanding of what it entails and what it's all about.
Well, typically my patients will seek me out because they are just not feeling like themselves anymore. They typically are, say, 40 years old or above, maybe 40 to 65 years old. And if it's a woman, they tend to experience hot flashes, night sweats. They may become depressed. They typically gain a lot of weight. If it's a male, he may be extremely fatigued, loses mental focus, loses drive and ambition. He'll typically gain the abdominal weight and just feeling pretty grumpy. So they typically have been well read, and they know that there's something that can be done to prevent all of these symptoms. They just are tired of being tired. And most of my patients have heard of what's called bioidentical hormone replacement therapy. So I have done a fellowship, completed a fellowship in anti-aging and functional medicine, and a big part of what we do is replace hormones with natural hormones, not synthetic hormones. So they find me because they've tried synthetic hormones and they're looking for something different. So that's typically the type of patient who will see me. And then what happens is I meet with them. In the field of anti-aging, we typically spend a lot of time with our patients, and we determine their lifestyle. Because as you mentioned before, you may have a genetic predisposition for a certain disease process or condition, but 20% of whether or not you develop a disease is related to your genetics, and 80% of it is due to the environment that you put your genes in. So lifestyle, eating the proper diet, just as you said, the proper exercise, all of that's important. So what generally happens in my practice is I will evaluate the patients, I will do hormone testing, and I use saliva testing typically to test for hormones. And then I explain to them, because most of them think that that's the only answer, that, you know, once they get hormone treatment, hormone replacement therapy, that they're going to be instantly better. And most of the times they're better, they feel somewhat better, they may sleep better, but I explain to them that your hormones are a symphony. They are a web, and you have over 600 hormones, so we do a lot of hormone balancing, not just of the reproductive hormones, but of other hormones as well.
So you've covered a lot of ground there, and you've given me a lot of places to ask questions. And still, going back to the beginning, when we talk about anti-aging, I think that people think, well, gee, is there something that's going to reverse my aging? When you think of the concept of anti-aging, I mean, what does that mean to you? I mean, that's a specialty for you, obviously, but what does that really mean, so people understand what that is?
It means to me that you detect disease processes early so that the person does not necessarily have to develop the diseases that are associated with aging, such as heart disease, cancer, strokes, diabetes, Alzheimer's disease. Most people think that these diseases just happen, but there are a lot of things that can be done to prevent it if we look for some of the signs early. So that's what it means to me. It doesn't mean that you're going to, you know, look 20 years old again if you're 60. I mean, unfortunately, it isn't that way. But most of the time, once you get healthy and you put your genes in a good environment, balance all of your hormones, then you typically do feel a lot younger. And there are also things that you can do to look younger, and we'll discuss, you know, that as well.
And we will get to that. So you're basically saying that you don't have a potion, a bottle from somewhere in Florida that Ponce de Leon was looking for, that fountain of youth, and that you come see me, you'll get a swig of that. No, you're talking about a very functional element of looking at how the body works. You can recognize certain disease processes that are evolving or that may be present and affecting your day-to-day living. Exactly. And of course, you're talking about bioidentical hormones, which will help people understand a little bit more about. But let's deal with a specific area. Thyroid seems to be one that a lot of people have a very delicate balance of, and that the environment seems to have some impact on. Give us a little example as to what kind of symptoms people who have thyroid deficiency or excess might have, and what you do to assess and to treat them.
Okay, I see hypothyroidism a lot, more than I see hyperthyroidism. In fact, most of my patients do have hypothyroidism. And they typically will feel very tired, very fatigued. They may lose the outer 1/3 of their eyebrow. The hair tends to get really thin. They notice that their skin becomes very dry. They become constipated. And there are lab tests that you can run that will show you whether or not the person has a problem with their thyroid, whether they have low thyroid or not. Specifically, I will look for a TSH, thyroid stimulating hormone. The pituitary produces that. And ironically, if that level is high, if it's above 2.5, then that indicates to us that the patient's thyroid function is not correct. It's not functioning well. We look at a free T3 and a free T4 as well. And I also look for thyroid antibodies. I see a lot of patients who have antibodies that are actually attacking their thyroid. But generally, the patients who I see with thyroid disease or hypothyroidism also have adrenal issues as well. The adrenal glands control metabolism just as the thyroid gland does. Those two are glands that really make a difference in how we metabolize even food. Right. And so if the adrenal glands, because a lot of people are under stress chronically, and so they produce a lot of cortisol. And when the adrenal gland starts to poop out because it's produced so much cortisol and epinephrine over time, then the thyroid gland starts to take over. And much of what I see with patients is they are deficient in many nutrients. So a lot of times if we need selenium, zinc, and iodine for the thyroid to function properly. So if those nutrients are deficient, then the thyroid doesn't function well either. But typically, just to answer your question, weight gain, fatigue. Fatigue is a really big symptom that I see.
So weight gain, fatigue, thinning of the hair, some changes in the skin, and constipation.
Constipation.
You said. Those are the main symptoms that people might be aware of that really might bring that to their attention, that was a possibility. Should everyone who's just overweight have their thyroid checked?
I check everybody who's overweight. I check their thyroid, absolutely.
And it's an interesting coordination, because this is not particularly the way most internists may look at the thyroid. I mean, you get a low thyroid test, and that's the only thing that's really abnormal, and that's the only thing you're going to look at. They aren't going to look at cortisol. They're not going to look at some of those other interrelated organ systems that help to balance out the metabolic functions of the body. So you will look at blood levels there, and you were talking about looking at minerals. Now, tell us a little bit about how those fit into the picture and how you do evaluate that and determine that you need to do something to treat them.
Well, there are different ways to test for deficiencies. We can test for amino acid deficiencies, and we can do that by drawing blood on the patient, but there is also blood spot testing that can be done as well. And the person only has to poke their finger, get some samples of blood, send it in to an outside lab. That's not a test that can be done locally at a Quest or a LabCorp, but we send that in, and the laboratory can determine whether they're vitamin, mineral deficiencies, amino acid deficiencies. And it's interesting, depression is another symptom that I see quite a bit, and we can see that too with hypothyroidism. And so typically, you think, we've always thought of, a pill for an ill, a drug for a buck. So most patients have been geared to think that, okay, if I have a symptom, I need a pill. But it's interesting that when we see low vitamin levels, B vitamin deficiencies, amino acid deficiencies, those are important in the production of serotonin. And if you don't have enough serotonin being produced, then that can lead to depression. So rather than treating with a medication, if we replace some of those deficiencies, then the person oftentimes has a big improvement with their mood, and the depression seems to lift.
So, and serotonin being what they call a neurotransmitter that's involved in those mood issues in the brain. And yeah, those antidepressants all just try to bump up that serotonin level.
Right.
And if there's no substrate or basic building blocks for those, it certainly does make sense. So you have the thyroid, you then decide, okay, we've done this testing, we've looked at your vitamin levels, your mineral levels, your amino acid levels. We have here evidence that your thyroid is under-functioning.
Right.
Adding in, of course, that autoimmune or the antibodies to the thyroid, which often you'll find in the family history too.
Exactly.
Because a lot of that's genetic. Of course, a lot of this starts with genetics, but
exactly.
But okay, so at that point, then you have started this whole comprehensive workup, right?
Correct.
And that involves, as I've heard from you, a very detailed history.
Very.
Going through their past medical history. Are there any other elements that aren't things that people routinely do that you include in that?
One thing that I would like to mention, I think it would be very helpful for viewers to know about, is vitamin D levels. We spoke about vitamins and minerals and amino acids before, but I specifically look for vitamin D levels, and low vitamin D levels are associated with breast cancer, colon cancer, Parkinson's, multiple sclerosis, and of course osteoporosis. And I would say that probably 80% of my patients have low vitamin D levels. Now, optimally, we would like to see the vitamin D level, some of the medical literature says above 50. I've even read recent literature that says above 80. I'm seeing patients' vitamin D levels at 14. So that's definitely, that's a person who needs vitamin D replaced. And again, we look at biomarkers to determine whether a person is at risk. Why treat a disease once it's already manifested if we can see before it ever manifests itself that we can do something about it and make that correction?
Sure. And of course, vitamin D is essential for the absorption of calcium
Exactly.
and its use in the bone. So you have women who may be running around with very low vitamin D levels who are setting themselves up for some pretty significant changes in their bones, osteoporosis and pathological fractures. Do you recommend everyone take a supplement of vitamin D? I mean, obviously, sunshine is supposed to help convert the nutrient intake that is the precursor that allows us to make vitamin D, and people who are out in the sun a lot are fine, but most of us avoid the sun. First of all, we aren't even near it because we're inside so much, but then if we get out there, we're told we're going to get skin cancer, and then we have to try some of those cosmetic procedures to try to reverse the changes in our skin. So do you recommend the vitamin D supplements for most people?
Well, a standard multivitamin does have 400 international units of vitamin D in it. And I recommend that everybody take supplements because basically our food supply is, we're nutritionally bankrupt actually. We are overfed and undernourished. There's a lot of food out there for us to obtain, but a lot of it really doesn't have the nutrients that we really require for our enzymatic functions to take place properly. So I think a basic multivitamin is necessary for everyone, but before you start supplementing vitamin D in high doses, then you need to know whether or not you actually have a deficiency. So no, I would not tell somebody you need to take 2,000 international units of vitamin D without knowing that they actually have a deficiency.
And you do have to be careful because you can overdose. And
correct.
There are a number of vitamins that can happen with the fat-soluble A, D, and supposedly E as well.
Correct.
So just for all those out there thinking, I'm going to go get a big vitamin and take a load of it, you want to be a little bit careful and get some professional advice as to what you should do. You were also talking about sex hormones, and certainly it's not just women.
Right.
Give us a little perspective on what you see. I mean, you said a 40-year-old woman who is having hot flashes. Of course, you think, well, gee, you should be 50 if you're having hot flashes at this point anyway. But are you talking about menopausal type symptoms in a premature spot in life? Well,
not even premature necessarily. I mean, women start to have what's called perimenopause even at age 35. So you can have a lot of the symptoms that are associated with menopause. Menopause is when a woman has not had a period for 12 consecutive months. So you can go through perimenopause for maybe 15 or 20 years before menopause actually takes place. But the interesting thing is a lot of my patients will come and they'll have hot flashes, but it's not because their estrogen levels are necessarily low. It could be because their cortisol levels are low. So the adrenal glands are very important in terms of how we feel and the symptoms that we have. So once I get the patient to take their herbal products that I can recommend for the adrenals, and of course engaging the relaxation response with meditation, yoga, Tai Chi, getting proper nutrients, getting proper sleep. That's a big issue. A lot of patients are not able to sleep well. And that's one thing that I have to work with them on, their melatonin levels. If you don't have enough B vitamins, you can't even produce proper amounts of melatonin. So melatonin is another hormone that I check for. And it's interesting that when I get patients to sleep and when I get them on a proper diet, get them nutritionally sound, balance their hormones, get their thyroid functioning properly, I'll treat their gut, intestines. A lot of people have bacterial overgrowth, yeast in their intestines. When I treat that, we're exposed to all sorts of toxins from chemicals, from the environment, from the food, from the water. Once I get their liver functioning properly to address their toxic burden, the interesting thing is that they lose weight. I have patients call. I got an email from one today that said that people had been telling her that she looked like she had lost weight, and she even felt better. So it's interesting that you have to get healthy to lose weight and not lose weight to get healthy. But if we do have areas of fat that we can't get rid of and areas that are resistant to fat, there's a program that I offer. It really addresses all of the things that we've discussed. And I do total body composition testing on a regular basis during this 12-week program that I do. It's called a 12-week metabolic makeover. And I basically get the patient very healthy, but I monitor them to make sure that they're actually losing fat and not muscle, because people get excited because they've lost weight, but you really want to lose fat and not muscle. You can slow down your metabolic rate and you can actually do more damage if you're not losing weight properly and having your body composition correct. So Now my friend Patricia here, she addresses the fat loss and with some techniques that you might want to talk with her about.
So what happens here, you have someone who comes in at a stage in life where their body has taken on a certain shape. They are overweight, let's say, and you work with them to start to lose weight. They go through this 12-week metabolic program, and hopefully it readjusts the balance of the hormones and their use of nutrients. But a lot of times you are at a point where your body shape is not necessarily going to change, or at least not within the period of time that you're willing to wait for that to happen. So, Dr. Pettit, you're more of someone who deals with the cosmetic side of what happens here. Give us a little perspective on the kinds of things that you do to help people in that situation.
Okay. Well, there's several treatments that you can use to help somebody lose fat pretty quickly. And I'm going to talk about two of them. One of them is mesotherapy, and the other is tumescent liposuction. Now, mesotherapy was first discovered back in 1952 by Dr. Pistor in France. And what he wanted to do was to be able to deliver a drug to the area where there was a deficiency or a problem, instead of having the systemic effects by taking it orally or intravenously. So he injected some medication for a pain patient. I think it was Procaine or procainamide or something like that. And it worked. The patient got better. So for many years in France, they were using mesotherapy for pain control. Other doctors here in America in the mid-90s decided that they would also use it for fat dissolving called lipolysis. And that's with a cocktail called phosphatidylcholine and deoxycholate, and then some lidocaine also to numb up. And the typical areas that you would treat would be like the eye pads under the eye, or the neck, the abdominal area, the love handles, thighs, buttock. There's all types of things that you can do with mesotherapy. There's a different type of treatment with it to treat cellulite, which we'll go over when I show you the slides. And then there's also facial rejuvenation, where you're injecting vitamins and minerals into the skin. And that's not what we'll be discussing, because we're talking about fat here and getting healthy. The other treatment is called tumescent liposuction, and this is different than the typical liposuction performed by a plastic surgeon, where the patient is put under general anesthesia. In tumescent liposuction, you infuse a solution of lidocaine with sodium bicarb and epinephrine, and the patient is awake during the procedure, so that if you insert your cannula in an area you're not supposed to be in, they can tell you. And so you don't enter the peritoneal cavity or scrape the fascia or anything that can happen during general surgery when somebody's under anesthesia and they can't talk back. Another advantage of tumescent liposuction is that you can stand somebody up during the procedure and see if you need to sculpt a different area. Whereas in the regular liposuction by a plastic surgeon, the patient is unconscious and they're laying there. So typically they have some deformities after surgery. They can have hematomas. They lose a lot of blood. They can have large volume, fluid volume shifts in their body. This doesn't happen with tumescent because the epinephrine constricts the blood vessels. And so when you go in and suck out the fat, you're sucking out tumescent fluid and fat.
So mesotherapy, you actually don't suck out. You have some slides.
I do.
Okay.
I do.
Well, why don't we show one of the slides here.
All right.
And we'll see how that goes. Now, with mesotherapy, as soon as they can bring up one of those slides, we'll be able to look. There we go.
Okay, here's one of my patients, and the next slide probably is also that same patient who had a little bit of extra belly fat and a little bit of love handles. And after 4 treatments, which is generally when you can see if your treatment is going to work, if they don't have any improvement with 4 treatments, then it's not going to help them, and you need to go to something else. Like,
so this doesn't require suctioning. This is just injecting.
This is injecting the phosphatidylcholine and deoxycholate, and it lyses the fat cell. It doesn't kill the fat cell, and the fat cell doesn't go away, and that's a very important point, because what you're doing is the deoxycholate will dissolve and emulsify the fat because it's a bile salt.
Okay.
But the fat cell is still there. And the person, if they go about doing the things they did before they met up with us,
Right.
then they can fill those fat cells up again.
So this just expedites the release of fat, and if you stay on a good calorie balanced diet, you're not going to regain fat there.
Well, hopefully. And if if you're in balance and you're exercising and eating the right foods,
right.
then mesotherapy is probably all you need.
Right.
If you have larger volumes of fat, mesotherapy wouldn't be the idea that you would use. You would use liposuction.
So, and the liposuction is the tumescent. You're basically instilling an anesthetic,
right.
and something that keeps the blood vessels from getting too dilated so that they don't bleed too much.
That's right.
And then you're doing the routine liposuction, but you're having somebody respond to areas where it might not be appropriate. Why don't you show us the other slide? Then we can see
and
what that
this
looks
is a liposuction patient.
Right.
And she actually had liposuction on her abdomen and love handles beforehand and came back and said she wanted to, now that her waist was so thin, she didn't like her bottom.
Right.
So we lipoed her bottom and her hips, and the after is 1 month after. So she looks pretty good.
And really, you can really see what the difference can be, because I've seen both kinds when they're lying on a table and there's gravity working in the opposite direction that it might be by nature. So you really can't see what the outcome is until they stand up and you say, oh, gee, I wish I had been able to do
Exactly.
that.
Like this patient, when she was on the table, after about 30 or 40 minutes, when I think I've gotten out enough fat, I have her stand up and I look at her from all angles, and then I draw where I need to sculpt.
Well, these are important things that you do, and I think that it really helps people if they've gone through a program where they feel much better. There is a real component of looking better that helps you have a total self-concept of making it there. And I think it's important that you are trained as physicians, because I think there are a lot of people out there who practice this without really understanding the basis of the diseases that they're treating.
Absolutely.
So I remind our viewers, if you're going to be looking for this kind of treatment, that you really do need to seek out those who are capable of doing that. Dr. Lawson, Dr. Pettit are those. Of course, they are members of the Medical Society of Northern Virginia. Of course, I want to thank you for watching us. You know that you can go to the website, www.msnva.org. You can find our doctors there. And until the next time, I'm Dr. Russell Libby, looking out for your health.